Eyewitness News presents Newsmakers with your hosts, Jayne and BUGDA and Andy MEHALSHICK.
Hello and welcome to Newsmakers. I'm Andy MEHALSHICK.
And I'm Jayne BUGDA. Opioid use and abuse is on the rise across the nation and here at home, and it impacts every community.
The Lackawanna Recovery Coalition is taking an active role in educating the community and helping those looking to break the cycle of addiction. We'll learn more about the coalition and its mission coming up today.
We'll introduce you to our guest, and our conversation begins when this edition of Newsmakers returns right after this. Welcome back to Newsmakers. I'm Jayne BUGDA along with Andy MEHALSHICK, and our topic today, we're taking a look at the use of opioids in our community and solutions to break the cycles of addiction. And Andy, it's a story that you've covered many, many times over the years.
When we were talking to our guests about it, it became so commonplace. It was almost like, here we go again, here we go again. And COVID sort of, I think, masked the problem because we're all focused on COVID, and rightfully so, but it's still out there, the opioid addiction, and these folks do a great job in helping people get out of that cycle.
So let me introduce you to our guest. Today we are joined by Barbara DURKIN. She is the Director of Lackawanna and Susquehanna County Office of Drug and Alcohol Programs, and Mark POWELL, the District Attorney of Lackawanna County. And we want to thank you so much for taking time out of your schedule to talk to us about this very important topic. And you're here today, we're talking about the Lackawanna Recovery Coalition. Tell us a little bit about the history, what it's all about.
So the Recovery Coalition started approximately 4 to 5 years ago as a response to the opioid epidemic. We were starting to see obviously an increase in fatal overdoses, and we're looking as a county to figure out a way to address those fatal overdoses. So it was really a community-based effort in partnership with the Lackawanna County District Attorney, who at that time was not Mark POWELL, but Mark has been brought in since then. And it's really just an effort to bring community partners together to talk about efforts to reduce fatal overdoses.
And we'll start off with, how big of a problem is it? Again, we talked about COVID really covering, that was a big focus. And even though we didn't talk about it, was it growing, or it's always been there?
So it's always been there, but actually the pandemic made it worse. So our numbers, despite all of our efforts, have actually increased because during the pandemic there's isolation, there's a restriction in getting help, and recovery is so community-based, and there's also added anxiety. So that, in combination with just the ever more presence of fentanyl, has really made this problem worse over the last few years. Now, our efforts are working. It would be even worse despite all our efforts that have been in place since the coalition had begun. But it is an ongoing problem, and fentanyl is really at the heart of it because it's deadly in small doses.
If you can, just explain what, people hear the term fentanyl, just basically what is fentanyl?
I'll leave that.
Yeah, so
I'll leave that to the DA.
It's 100 times stronger than morphine and about 50 times stronger than heroin. So it can come in very small doses, and it's an opioid. It's prescribed for pain, but on the street in very small doses, it can be lethal. And now we are unfortunately seeing it laced in almost everything from marijuana joints to methamphetamines to heroin, which is commonly laced with, and disguised to be given purely as fentanyl, but under the assumption you're getting a Percocet or an Adderall. And it's deadly. One pill can kill.
You know, people watching the show may be saying, well, I don't really have anybody in my family that's involved with drugs, or but this is a community problem that impacts every community. Tell us how it impacts our communities.
I mean, when you look at, we go out and do community events all the time, and we go out and we bring the naloxone, the recovery kits to different community events, and every time someone will say to me, well, I don't understand why I need this. I don't understand why I need to have, say, Narcan in my home. I don't have a family member who's struggling. And I always say to them, you don't know who you're going to come in contact with on a daily basis who might be struggling. You don't know who you might find, unfortunately, pass out on the side of the road. And if you have a recovery kit, you could potentially save that person's life. So it really is a community problem. You know, I believe that addiction does not discriminate. I think it could hit just about any person any family, any community, but we need to be acting together to have all the resources available for someone to tackle that issue. And, going back to what District Attorney Powell had said, people are going to unfortunately continue to use drugs. We know that. We have plenty of treatment facilities, plenty of resources to help them if they're willing to get sober, but there are people who will continue to use drugs. So we want to make sure that the resources are available throughout the community so that we can continue to save lives.
And if you can, most folks, I'm sure, have heard the term Narcan. What is Narcan, and when did it come on the scene?
So Narcan is naloxone. That's the actual name of it, and we have some here. We have the 4 milligram spray, and it is simply a medication. It's a nasal spray, but it comes in other forms as well that will reduce an overdose. It will reduce an opioid overdose. The unfortunate piece of this, and going back to the fentanyl discussion, you need a larger quantity of naloxone or Narcan to reverse a fentanyl overdose, which is why it's so scary that fentanyl is being laced in just about everything, or that substances are being laced with fentanyl. But having access to Narcan in anyone's hands is incredibly important at this point, simply because it is proven to save lives.
Yeah, it's a life-saving drug, and it alone isn't enough, but it can give someone that second chance. They still need to go to the ER, and then we need to have programs to get people from the ER into recovery. But it's a second chance, and if you hear the stories, and they are very real, and you hear the stories of someone coming back to life after Narcan and then getting recovery, it's inspiring as could be. And if we could just save one life, it's worth it. But we know we've saved many.
Now, I know we were showing some video from your website that shows actually how someone can administer Narcan to someone who's in an overdose. If I help someone, what is my responsibility? I mean, after that happens.
Yeah, well, essentially, you can't harm anybody with Narcan. It's a nasal spray. It has no bad effects other than the good effects of bringing back someone to life. But there is a Good Samaritan law that would grant immunity to you for criminal prosecution if you report an overdose, stay with the individual on the scene. So, and I can tell you from a law enforcement perspective, those are the folks that are trying to help, and we're not targeting those individuals in any type of law enforcement investigation. But there's a law that provides a shield or protection for them for doing the right thing.
I've heard of some programs, and maybe it's yours or those in the area, where if, say, a first responder administers Narcan, at that moment, if they can, are they supposed to, there's some move about explaining to the person you gave Narcan to where there's help with his counseling. Can you expound on that a little bit?
Sure. So we have implemented within Lackawanna County, and it was part of the Recovery Coalition, some of the initiatives of that group, some warm handoff programs. It's what they're called across the state. And essentially, when someone who has either come in contact with, say, law enforcement or come in contact with a first responder and is revived via Narcan, the goal is to either give them resources to connect them to treatment, but ideally it's taking that person to the hospital. And then there are actually individuals, they're called certified recovery specialists, who are embedded at our local hospitals within Lackawanna County, but all of the counties in Pennsylvania have them. And those are individuals that when someone comes in on a fatal overdose or a non-fatal overdose, or even comes in under the influence of alcohol or any other substance, that certified recovery specialist will meet with that individual, talk to them about their own story, and then attempt to place that person into the appropriate treatment.
Because that specialist has been there, done that.
Absolutely.
So they can relate and really be able to say things that the person who's is addicted would understand. They can connect.
Absolutely. And what we're looking to do actually is we're looking to expand upon that and make it more of a community-based program so that folks wouldn't have to go to the hospital, because we know there's some stigma related to going to the hospital, and medical professionals maybe not understanding. So we're actually looking to have certified recovery specialists go out into the community, maybe take a call from a law enforcement officer or from a first responder, meet up with that person at their home or at the scene of wherever they were revived, and then connect them to treatment from there. So we're looking to expand it.
Tell us about some of the programs that you offer the community You know, you hand out these kits to the community, but what other type of programs do you do right in that are based in the community to educate?
So there's not one cure for all this, right? So the Narcan's a start, but it's really getting someone assessed, getting them treatment, and then that individual then working a program. So there are multiple opportunities to do that. And we know these work, we just need to sustain them. So as Barbara indicated, that warm handoff program is critical, because just because someone's been revived doesn't mean they're going to go back and not use again. So we need to get that intervention very early on and ongoing. We've expanded our programs in the prison, because we know when someone's incarcerated, they're not necessarily getting help that they need, they're being punished. But we're trying to implement some of these programs in the prison, and unfortunately, when people get released from prison, they're 10% more likely to use and have an overdose within the 2 weeks of being released from prison. So that data is helpful for us now to know we need to target those individuals. So there are lots of programs out there. Just the information alone is helpful, because there is such a stigma associated with this. People think they're alone and they're the only ones going through with this problem. There are a lot of services out there. People are reluctant to get the services. Reducing that stigma is critical, and just the more information, and we do that with community events. We go to libraries, we have discussions with individuals, we give these demonstrations for Narcan, but for the purpose of getting Narcan in the right hands, but also educating people of all the services that are out there, that Barbara really is a wealth of information on as to where to go to get help.
Is there the demographics of someone addicted to opioids? Is there a certain age, gender? What are you seeing?
So, you know, what we're primarily continuing to see are males between the ages of, say, 21 to 40, who are the ones who are most heavily using opioids. But what we are continuing to see is that age increase. We're seeing a significant increase within our elderly population. Obviously, we know that some doctors are no longer prescribing as many narcotics as they have in the past, which is very positive. But unfortunately, we have a lot of older adults who have relied on narcotics for a long period of time, and sometimes their doctors have cut them off, probably appropriately. So we're seeing an increased use among that population at this point. We're targeting a lot of our programs to ensure that there's resources available for older adults to connect to treatment. But they have a lot of medical issues as well. We're seeing an increase among women, which we had not really seen before. So yeah, it doesn't discriminate, but the ages remain fairly consistent over the last couple of years.
That is surprising, the older age group.
Yeah.
But is because they have longer term health care issues and they want relief. And maybe when I heard years ago when, well, it was a magic drug, you gave it out and, you know, doctors, and it was an educational curve, and now all of a sudden it's out there. Now how do we put the GD back in the bottle?
Correct.
Right.
Yes.
And many are prescribed long-term opioids, and that does form the basis of the addiction. So yeah, no one is immune from it. Let's just face it. It affects the wealthy, it affects the poor, it affects all folks. And we see, unfortunately, examples where you would never think it would happen, but it does.
On that note, very quickly, when really the awareness of opioid overdoses was happening all across the area, you know, you would go to a certain place and say, boy, it's happening in this neighborhood, or it's happening in this community, and the discussion was, I never thought it would happen here, or this person we would know either personally or find out later. It's like you wouldn't think, they don't fit the mold if you think about a drug user, you know?
Yeah, and that goes back to, you know, some of the stigma around it and the fact that, you know, addiction doesn't discriminate. It could touch any person's life. I think that's why we do a lot of the recovery stories that we have on the website, on the Recovery Coalition's website, to show that there are people from many different walks of life who have been touched by addiction and who have recovered from addiction. I think that's the positive piece of it too, is, you know, that there is recovery available if someone is interested and willing to obtain it.
You know, we talk about the dangers of drugs, and we explain it to young people, and we explain this, but why aren't they getting the message? Why doesn't somebody see something or hear these stories that these people are telling? Why doesn't it scare them?
Yeah, I'm sure some do, but it is such a strong grip And so when someone experiments with it willingly, or it's filtered into some other product and they take it unknowingly, it's a physical addiction that they have. And the need to fill that addiction grows and grows and grows. And it's just a vicious cycle. You know, some of these folks really don't care if they die or live. They're really in the thrills of addiction. It's only when you can kind of break that, get them out of the physical dependency, you can then work on the mental aspect of it to try to give them the help and support to break it. But it's a terrible, terrible condition, but it's treatable.
What about the healthcare community? How do you bring them into this? How do you have them talk to people or talk to their patients about this?
We've done a great deal of work over the last 3 years, at least, since District Attorney Powell has been involved in the coalition with educating the medical community about the dangers of opioid use. We've held a number of meetings with medical professionals talking about, you know, the struggles that we have had. I think that they're where they need to be. I just think that COVID, quite frankly, has made it very challenging for us to continue some of those efforts. We had at one point a great number of medical professionals who were part of the coalition, and they're still wonderful members, but they're so tied up with everything that is still going on with COVID that their minds are just stuck there. So I know in the next year or so, I would really, and I'm sure Mark would agree, really like to see more focus there on bringing the medical professionals back into the coalition, doing some more community outreach, ensuring that they have what they need. You know, we need to make sure that if someone comes into a doctor's office and is clearly struggling with an addiction, that medical professional knows who to call. So we've done some work with some of the professionals who are still and continue to be engaged in the coalition, and given them obviously the information that they can call us, and we're going to continue to do that level of outreach. But it's hard.
Doctors want to help patients, right? They want to do the right thing. So they have really embraced this to develop best practices, to have checks and balances when someone's on pain management. So from a management standpoint, the doctors and physicians are really doing a good job now, where historically they just didn't have the same knowledge of the problem these drugs were creating for people. So there have been great strides made in that direction.
And Barbara, how often, and Mark, families involved? You know, every family says, it's almost like, I didn't think it would happen to me, or I was unaware of it, or they knew something was happening, probably opioid, and they didn't know what to do. And they, you know, I'm not saying ignore it, but thinking, well, or their family member would say, I have this under control, don't worry about it. But they have to be, I would imagine, a key part in this whole addressing the problem.
Absolutely. I would say during any given week, we get a call from at least 1 or 2 family members who are really looking for help for their loved one. They've tried every avenue to get their loved one to admit that there's a problem, and then, you know, they contact us. And I think that number has actually increased over the last couple of years, because I think families are seeing more substance use than they ever have before, and I think opioid use is so scary that everyone is very much aware of it and wanting to help.
Well, we are going to take a quick break, and when we come back, we will continue our conversation with the Lackawanna Recovery Coalition. You are watching Newsmakers, and you can find out information on today's program on PAHomepage.com. We're under the Newsmakers link. And you are watching Newsmakers. We are a proud recipient of 3 Pennsylvania Association of Broadcasting Awards for Excellence in Public Affairs Programming and a Keystone State Award for Best Talk Show. And we'll be right back. Welcome back to Newsmakers. Jayne and BUGDA along with Andy MEHALSHIK. And today we are joined by District Attorney Mark Powell from Lackawanna County and Barbara Durkin. She is the director of the Lackawanna Susquehanna County Office of Drug and Alcohol Programs, and we have a very interesting conversation going on about how opioids impact our community. And I want to ask this question, is it better for prison or treatment?
treatment.
Yeah, sure. And we have great
And we might
diversionary-
disagree.
Okay.
We have great diversionary programs. I mean, clearly the individuals who are pushing this poison, we have to send a message, and jail is the appropriate remedy. But there's so many people who are really just feeding their addiction, have treatable use disorders. And so if we can get them into a diversionary program where we can get them help, we're going to stop that revolving door. And that's the goal. And Lackawanna County has a great diversionary program, drug court, that's been in existence for 20 years. We've expanded that to some lower level tier crimes and a Fresh Start program. But diversion is clearly the better answer. And there are great success stories of people who have gone through the system and come back and work the program and help others. It's a really, really positive direction.
And what are you seeing on the street, Mark or Barbara? When you think about dealing drugs, people with the shadowy figure on the corner, that's happening, right? I mean, that's out there.
It is, but we also see it on the dark web, and people are ordering drugs, thinking they're an Adderall, but they're a fentanyl tablet, and they're being disguised as such. It's really at multiple levels. But we have to reduce the supply and the demand. So the demand is the treatment. The supply is the influence of law enforcement to stop these drugs from coming in. But they're coming in, fentanyl in particular, at alarming rates. And it's a hard fire to put out because it just keeps burning despite all your efforts. So unfortunately, if we arrest one drug dealer on a corner, a week later, there's going to be someone there to replace it.
And very quickly, the money they can make selling this stuff, the bad guys. A lot of money, obviously.
Sure, and it's all on volume, but candidly, fentanyl has gone down. It's probably reduced in price on the street about 50% from 2 or 3 years ago. So the more availability, the price has come down, and it's even more prevalent.
Wow.
And I want to say, with Narcan and fentanyl strips, does that encourage use?
Yeah.
I don't think so. I mean, they're part of the harm reduction strategy. I know that there are some people who feel like it would, encourage someone to use. At this point, we're looking at it as a life-saving effort. We want to make sure that we have enough resources and tools out there in the community to save lives. And if, as part of that, we give out Narcan, or even if we are ever able to do fentanyl testing strips, if we have resources as part of those kits to connect people to treatment, we will eventually see additional individuals go to treatment. We know that the Narcan and the initiative with the Narcan mailings has saved lives. We have received word from multiple families who have thanked the district attorney and others for having those available because it has saved a family member's life.
And we always have the drug give back, public give back, canisters here, giveaway or take backs. How big of a deal or of an issue is prescription medicine in the home that someone can have access to, that shouldn't have access to?
Right. All these programs work if they're working effectively. And any of the old medication that's subject to a grandson stealing their grandmother's prescription drugs, we have to reduce that temptation. So any of these disposal of drugs and doing it in a responsible way is a step in the right direction. And I've heard those arguments about Narcan and fentanyl. I personally don't buy them, but the good far outweighs the bad, right? Having Narcan available to save people's lives far outweighs any rumor out there that maybe it promotes drug use. It just doesn't. They're using drugs. They're just using them and dying if Narcan's not available.
Now, if someone calls your coalition and says, can you come and speak to us? You will, right?
Absolutely.
So I
Absolutely.
want people to know that we do have that information on our website.
Absolutely.
That if someone's looking for a program, whether it's a senior citizens or whether it's what is the earliest age to start talking to children?
Young. I mean, we do prevention programming in the schools, and it starts in kindergarten.
Wow.
Yeah, it's young. Obviously, you have to tailor it to that age range, but young.
And more significantly, we know when we trace these back, it's usually some form of childhood trauma, some form of untreated or undiagnosed mental health issue, and drug use before 16.
Most things come back to funding. The Attorney General's office had a big settlement with pharmaceutical companies, whatever. What kind of a challenge you face with that? doing what you do with funding, and where do you get the funding?
Yeah, that's a great source, so we're looking forward to that. And there is a lot of money devoted to this. We know what works. We need to sustain these programs. That's really the key, is sustaining the programs, because we know what works.
We have under 2 minutes, and I just want to, touch out to somebody out there that's watching and wants to take that step and say, I think I'm tired of this. What should I do? What is the first step someone should do if they're looking to break the cycle of addiction?
I mean, quite frankly, it's just picking up the telephone. It's reaching out to a family member saying, hey, I want help, and then making that call. I think that's the hardest part, is picking up that telephone. And then once that happens, it's easy. The more we can as a coalition get the word out there that recovery is possible, the better off we're going to be. The more we can get those recovery stories out there so that someone can see. My office is available 24/7. We obviously have highlighted our 24/7 number. At any point, someone can call any hour of the day, and one of my staff would answer the telephone and talk to them and assist them in accessing treatment.
Well, we have less than a minute. Barbara, DA Powell, we want to thank you for joining us today. And we want to remind everyone that the information you heard on today's program can be found on pahomepage.com. They do give away these kits. The kits have Narcan in them, and they have information that are helpful for people that are looking to break the cycle of addiction. We want to thank you for your work in your community, both of you, and thank you for joining us today.
Thanks for having us.
For Andy MEHALSHIK and everyone behind the scenes, I'm Jayne BUGDA. We thank you for making Newsmakers part of your day, and we'll talk again next time.